Assalamualaikum dear doctor. In this video I am sharing information about how to prepare for developmental short cases. So you will enjoy the developmental station if you are adequately prepared for it. In the MRCPCH clinical exam, the examiners are not looking for a developmental pediatrician but a general pediatrician who can recognize a child with a developmental delay and suggest an appropriate management plan. The examiners usually will not request for a full developmental assessment. More often, they will tell you the child's age in the lead-in statement and request for the assessment of the child's developmental age in a particular domain. Example, fine motor and vision or speech and language. However, if the leading team requests to assess the child's development without indicating a particular domain, it will be useful to start with fine motor assessment and to keep the gross motor assessment towards the end. Here are some tips for developmental assessment. So, number one tips is that many candidates memorize the developmental milestones by remembering what a child of a particular age can achieve in all four domains. For example, a 3-year-old boy could ride a tricycle, copy a circle, speak in 3 to 4 word sentences, and dress himself with supervision. However, this often leads to difficulty in performing an examination smoothly when they asked to assess the developmental age of a particular domain. We would strongly recommend approaching a developmental case by remembering the skills in sequence that could be assessed in each domain. For instance, in fine motor assessment, the candidate could assess the child's ability in turning pages in a book, build a tower using blocks, pencil grasp, threads, beads, and cut a folded paper using a scissors. Number two tips is that in an exam, you should start the assessment from where the patient is before you get them to a table task activity. Remember, if the child cries, you will lose cooperation. Number three tips is that start with a simple task before moving on to motor complicated ones. If the child successfully completed a given task, move on the subsequent activities till the child meets his or her ceiling. Number 4. Tasks the required demonstration will need the child's attention towards the item offered to him or her. Will be good to do this as a table task activity. Remember to remove the completed item prior to moving on to the next task to avoid distraction. Number 5. If the child performs well, offer praise immediately. If the child is unable to perform the required task, reassure him or her that it's okay and step down to a simpler task before getting the child to attempt. Number 6. If you have difficulty in engaging the child, sought the parents' help. Involving the parents often encourages the child to engage with the task at hand, particularly if it is interesting. You could then slowly join in and take over the parent's role. Number 7. When presenting, comments up to the child's best potential and avoid negative phrasing such as he could not or he was unable to. To be proficient in developmental assessment, you will have to diligently practice on typically developing children. If you become more skillful in this, you can then confidently start examining children with developmental problems. Last but not least, one has to have patience and great enthusiasm to be successful in this station. Good luck. So this is all about. Thank you.